Hello, my name is Ronnie Smith. I'm a registered respiratory therapist living in Southern Ohio. The reason I'm making this video is mainly for up-and-coming respiratory therapists who are working in the hospital now and respiratory students. I've been a therapist for 9 years. I graduated in 2003 from Shawnee State University located in Portsmouth, Ohio. Anybody who has any aspirations of becoming a respiratory therapist, it's a very good school to go to. Worked as a therapist for 6 years in a community hospital, and I also worked 1 quarter, which is about 3 months, at Shawnee State doing the clinical PFTs. The reason I'm making this video is just to let people who are thinking about becoming a therapist, or people who are already a therapist, and especially students, to let you know that don't get discouraged. You're going to be meeting a lot of people in the hospital who, I hate to say it like this, are going to treat you very bad. You're going to be cussed at, you're going to have stuff thrown on you. That's just part of the game. I hate to call it a game, but that's how you got to look at it sometimes. You're going to work with obnoxious doctors who think they know more than God. Trust me, I know how some of you might be feeling, because I've had to experience it all myself, and I know what you're going through. Okay? I know when I first started out, I felt like I didn't know anything. And that's okay to feel that way. Especially when you're working with a therapist who's got 30 years under their belt. With time comes more experience. With experience, you'll learn a lot more. I'm the type of person who learns hands-on better. So, the many years you stay in the profession, the better at you'll become, and the more you will learn. You'll learn more working in the hospital than you ever did working in a lab at your school. But just some things I want to let you know, just some tips. Always try to be professional at all times. Even when you're getting cussed at, you'll get cussed at by patients' families. Sometimes you get cussed at by the doctors. But always be professional. Remember, you are a respiratory therapist. Just do what you've been trained to do, nothing more. Okay? Another thing to always remember, if you don't know a question to don't know an answer to a question, just go look it up. A lot of hospitals have libraries, medical libraries, or you can get you one of these right here. This is the Clinical Practitioner's Guide to Respiratory Care, Dana Oaks. You can pick these up on Amazon.com. Very nice. I've had this one since 2003, and all I can say is this is one of the best books to have with you when you're in the clinicals. And it's small enough to where you can put in your scrub top. Keep it with you. There's a lot of pages full of equations. Talks about ventilators, PFTs, EKGs, everything. Perfect thing to have for a reference guide. Perfect. I think every respiratory therapist in this country should be issued one of these when they're in school, and maybe some universities do. Mine didn't, though. We had to buy ours separate. But anyway, I've had this since 2003. You can get them on Amazon, brand new, updated versions, or you can go on eBay and get them. It's perfectly up to you, whatever you want to do. Another thing. One thing you're going to run into a lot of, and I ran into this the other day when I went for a job interview, are therapists who think they know more than anyone else. They're going to be very obnoxious, very cruel sometimes. Just don't get discouraged. And remember the saying from the Bible, do unto others as you would have them do unto you. Don't be rude or obnoxious to anyone. Be a professional, and you'll come out on top. Okay? So, once again, this is Ronnie Smith, registered respiratory therapist, signing off. Take care, and God bless always.